Good evening, doctors. Welcome again. Today we are going to discuss about image-based MCQs. And guys, this will came at least 20 or 25 MCQs image-based in your exam, Neet PG. So let's start. I'm not going to waste your time too much by talks. So let's start. Identify the portion of male urethra which is arrow mark. This one. This is known as C. This is prosthetic urethra. This one is membranous urethra. So answer here is membranous urethra, and this is bulbar urethra, penile urethra, external urethral meatus. This is bladder, intravesical, extravesical bladder. Okay, and here it's verumontanum. So I hope it's clear for you till here. So here they give the arrow, and this arrow even is membranous urethra. Please remember this, guys. Now, the most common cause of this condition shown in the following picture is this is imperforate hymen. Okay, remember this is imperforate hymen. I hope it's clear for you now. USG ovary showing multiple small cyst structure. Ovary is increased in size and there is a string of pearl. A string of pearl seen in PCOD. The patient complains of irregular menstruation. Most likely the diagnosis on the base of investigation. These are the pearl necklace patterns. See, necklace, cyst. So we can see polycystic ovarian syndrome or Steven Leventhal syndrome. Now, which of the following techniques tubectomy is depicted in the diagram? So this is known as Pomeroy's technique. How they do this? Then they clamp and then they cut and they remove. This is known as Pomeroy's technique. Now, identify the contraceptive device shown in the picture. This is known as female condom. Okay, looks like. The image shown Morrissey procedure. The procedure shown is being done for. This is after coming head of breech. Okay. Now, Gravida presents at 36 weeks of gestation with complaint of preterm premature rupture of membranes or leaking per vaginum, and the following presentation management to be followed is by LSCS. Okay. Identify the tube depicted in the image. We are going to use this tube in where? In recovery room after surgery. It prevents tongue fall. So it is known as maintain patent airway. Okay. Now, identify the airway tube depicted in the image. This is known as laryngeal mask. Very easy to put. Okay. Machine shown below is, this is known as Boyle's apparatus. Okay. Now, identify the pathology in the X-ray given is, this is dislocated THR head from cup. Okay. X-ray lateral view, lumbar spine shows compression to vertebra. Here is the compression. Here it's compression. So this is seen in Pott's spine, or we can say tubercular spine. A child present with FTT and the wrist widening X-ray of wrist joint showing cupping, frying. The most likely condition causing this appearance can be rickets. This appearance is rickets. Okay, guys, I hope it's clear for you till here. Now, image shown X-ray of hip joint with femoral necrosis. Identify the condition leading to this radiographic appearance. This is known as Perth's disease. Now, identify the X-ray. See here, what is it? Osteopatrosis. 58. Answer is osteopatrosis. X-ray showing deformity of hands are typically of rheumatoid arthritis. This represents 55-year-old woman present with bilateral knee pain. Since 5 years, pain aggravates, especially on weight-bearing joint. On exam, dull edge in nature. On examination, crepitus. The X-ray shown below. What is the most probable diagnosis on weight-bearing joint here? This is knee joint osteoarthritis. Okay. Arrow head in the following X-ray. This arrow of head represent head of radius. Now identify the X-ray. This is Montagia fracture. Montagia fracture. Now identify the X-ray. What is it? What is this? This is tophus of gouty arthritis. We see most common involvement jointed second metatarsal and third metatarsal. Okay. X-ray of wrist joint is given below. Identify the bone marked by the arrow. This bone is lunate. So guys, I hope till here it's clear for you. It's very clear. Yeah. Now, X-ray carpal bone. Identify the marked structure. This is hamate. 26th answer is hamate. Identify the arrow mark in X-ray of shoulder. This is coracoid. Okay. Now, X-ray of ankle joint. The arrow at a bone. Identify the marked bone. This arrow, see this arrow. What is it? Navicular. This is navicular. Image of surgical condition is shown below. Spot the diagnosis. See. What is it? In old age we see such. What is it? Varicosity. It's varicosity. D. Now, a 50-year-old male presented with swelling of right groin while occluding the deep inguinal ring. The swelling reappears. What kind of hernia is it? This is known as direct inguinal hernia. How? Because it reappears when swelling. Now, image shown below. What is this? This is intracranial tumor. B. Answer is intracranial tumor. Okay. Let's discuss MRI of brain shown below. Identify the structure. Looks like intraventricular space occupying the lesion. So answer is A. Thalamus, B. Caudate nucleus, C. Genu of internal capsule, and D is posterior limb. Hope till here it's clear for you very well, and I hope this is time saving. Picture showing the characteristic of this shows varicocele. Okay. Tense, non-tender cystic swelling as shown over the dorsum of wrists. This is known as ganglion. This is known as guys ganglion. Okay. What was the treatment? Surgical treatment or aspiration, you can say. I hope till here it's clear for you. Sorry. Now, image shown below is a swelling which is sleeping below the fingers. When surgeon tries to palpate, most likely diagnosis is lipoma. Now, A retropositive patient developed erythematous plaque over ankle sole of foot. HPE shows abnormal vascular endothelial cells with a typical spindle cells. Picture showed patient foot. Microscopic slide view. This is known as Kaposi sarcoma. Okay. A patient present with lesion over chest after 3 months after cyst removal. Most likely diagnosis here is keloids. Now, machine shown below in the image is used for psoriasis and vitiligo both A and B. Now, characteristic nail changes from a patient to lichen planus are shown in the image. Most likely diagnosis here is patricium. Okay. Now, picture shown is suggestive of this is erythema multiforme. This one we can say erythema multiforme. What do you think? What is it? It's erythema marginatum. Okay. So this is known as confusion here. So guys, think what is it? It's erythema multiforme or marginatum. Think by your own and tries to answer me. Okay. Now, a child developed multiple lesions over face, neck, and trunk as shown in the picture after eating strawberry. These lesions are best described as these are known as wheal. So ninth one here is it represent wheel. Okay, hope it's clear for you now. A child present with white lesion depigmented macule of 2 into 2 centimeters with irregular margin over forehead and glabella. There is white forelock over forehead since the birth diagnosis is. See guys carefully and think about it. What was the diagnosis here? It's fiabaldism. Fiabaldism. Okay. Now, identify the pathology depicted in the image. See, what is it? This is contact leukoderma. Contact leukoderma. Till here, it's very much clear for you. Now, let's take individually. Lesions shown in photograph. Shown below the suggestive of. See guys carefully. Answer here is Cobner's phenomena in vitiligo. Now, 45-year-old male present with scaly lesion over a back. The most likely diagnosis here is erythrodermic psoriasis. This is erythrodermic psoriasis. Now, hypopigmented patches over a skin of face and chest. The most likely diagnosis here is pityriasis vesicolor. Pityriasis vesicolor. Okay, now parasite shown in the photograph can cause which of the following disease? It causes scabies. Scabies. Biopsy from the face lesion of this patient showed perineural invasion. What is the most probable diagnosis? Lepromatous leprosy. It's lepromatous leprosy. A child present with indurated boggy swelling with crust and hair loss over scalp as shown in the image. The most likely diagnosis here is so guys this is trichophytone. Picture showing skin lesion with subside with the use of steroids. for 5 days but reappears after stopping the drug. Most likely diagnosis is, see guys carefully, answer is tinea incognito. So hope till here it's clear for you. We already done till here. A single hypopigmented hypoaesthetic patch shown below the image is suggestive of leprosy. This is leprosy. Leprosy. Picture showing skin lesions which disappears after biopsy. What is the phenomena called as? See guys and think about it. This is remote reserve Cobner's phenomena. Now, identify the pathology depicted below. This is lens subluxation. This is the lens subluxation. Hope till here it's clear. Pathology depicted in the slit lamp view shown image. This is posterior polar cataract. Identify the type of cataract depicted in the image is zonular cataract. Is known as zonular cataract. Identify the instrument given in the image. This is tonometer. This is known tonometer. Remember. Now, otoscopic finding shown below is of retracted and atelectic tympanic membrane. Okay. X-ray lateral view neck is shown. The arrow mark indicates the given image. What is this? This is, see guys carefully. Answer is cricoid cartilage. Now, a 56-year-old male complaining of cough since last 7 months has been advised a sputum culture and stain. He was working in asbestos factory but has retired since. The structure shown in the image the most likely to be, see guys carefully, ferruginous body. Okay, ferruginous body. Now see this image. A 45-year-old with trauma presents after 4 hours with swelling of cheek and urine not passed. On examination, crepitus is palpated with preorbital swelling. What is your diagnosis? Lung laceration. So this is lung laceration case. Discuss individually. Following chest X-ray shows, what is this? This is heart. On which side? This is on right side. So this is known as dextrocardia. We see right-sided heart where? Cartagner syndrome. Situs inversus and sinusitis. Situs inversus means right-sided heart and right-sided organs. Now, chest X-ray shows the marking near the costophrenic angle that cause these markings are. This is known as lymphadenitis carcinomatosis. Okay, ECG shown below. The depicted wall, second, third, AVF, inferior wall, MI. ECG shown below depicts, see guys carefully, answer here is anterior septal. What is it? MI. ECG tracing showing the heart block. This is first degree heart block. ECG given below is of Atrial fibrillation. This is atrial fibrillation. Remember. A patient present in emergency with palpitation and sweating. ECG changes shown below. The drug of choice for reversal of this condition, that is adenosine. This is paroxysmal supraventricular tachycardia. Classical RSR V1 shown. The image in V1M and V6 is W, that is right bundle branch block. If V1W and V6M, that is left bundle branch block. Tracing of ECG, AVL and first lead are given. Point out the diagnosis, it's lateral wall MI. It's lateral wall MI. ECG given in showing Wolff Parkinson White syndrome. Delta waves. Okay. Characteristic ECG changes are mainly seen in, see guys, this is hyperkalemia. ECG strip showing which electrolyte abnormality here. Hypokalemia. Hypokalemia. The image shown is the presence of implantable cardioverter defibrillator. 70-year-old hypertensive patient with complaint of palpitation and pre-syncope. On examination, his heart rate 72, blood pressure 150 by 100. The ECG shown here, atrial flutter. ECG shown here is atrial flutter. Remember. 62-year-old male with underlying COPD develops a viral upper respiratory infection and begins taking an over-the-counter decongestant. Shortly thereafter, he experiences a palpitation, presents to the emergency room where the given rhythm strip is obtained, demonstrating. So, what is it? It's atrial flutter with 2:1 atrioventricular block. A 50-year-old male who had recently joined a gym collapsed on the treadmill. He was rushed to the hospital where an ECG shows the presence of C V2, V3 and in AVL in first. So this indicates mainly what guys? Acute extensive anterior wall MI. Angiography in the image shown below the marked vessels here is internal carotid artery. Beak's bird is a sign of achalasia cardia. Such so many times repeatedly asking. Image shown below indicates colonic obstruction. Image shown below indicates gastric outlet obstruction. By looking the image, the probable diagnosis here is GB stone. This is GB stone. Image shown below that indicates pancreatic calcification. Procedure shown below is see guys, transverse colostomy Let's discuss individually. Radio image shown the technique of barium meal follow through. So this is the barium meal follow through, or what is it? It's barium enema, not follow through barium meal. Diagnosis the following technique. This is barium meal follow through. Image shown below. The characteristic of congenital hypertrophic pyloric stenosis. This is known as congenital hypertrophic pyloric stenosis. What is it? Coffee bean, we can say. Volvulus, we can say. Sigmoid volvulus, we see such. Image shows of hemorrhoids. These are hemorrhoids. Hemorrhoids. Okay. So answer here is hemorrhoids. Image shown below is of rectal prolapse. It's rectal prolapse image. Patient with ESRD end stage renal disease is being performed hemodialysis. Central dialysis catheter is placed at which site? This is neck and this site is right. So right internal jugular vein. This is right internal jugular vein. Now let's discuss one more question. Patient is scheduled for hemodialysis. The AV fistula is called as seminobrassica fistula. Okay. PKD1 mutation associated with kidney disease shown below. The diagnosis is autosomal dominant polycystic disease, kidney disease. Image shown below is of hydronephrosis of kidney. See guys, what is it? Double ureter. Image shown below is of PUJ obstruction. It represents PUJ obstruction. A lady present with joint pain in both knees and low grade fever off and on. Examination, she has rash on sun exposed part. Image shown below. This is what is it? Shape, it's butterfly. These are the butterfly rashes. SLE in SLE. Identify the predominant abnormally shaped red cell type seen in peripheral smear given below. Acanthocytes. These are acanthocytes. Peripheral smear is suggestive of which type of anemia? This is iron deficiency anemia. A young adult present with history of a bone pain, recurrent chest pain, in chest infection and dyspnea, peripheral blood smear. What is your diagnosis here? This is, see guys carefully, sickle cell anemia. 35-year-old male presented with complaints of bleeding from gums. There is a history of recurrent infection in the past 1 year. On examination, paler present peripheral smear of the patient is given below. Identify the arrow marked here. What is it? See guys carefully. Our roads. So hope till here it's clear for you. Okay, now we already finished till here. Now, one bone marrow biopsy owl eye nucleus was seen in cell as shown in the image. The diagnosis here is Hodgkin's lymphoma owl eye inclusion. Okay, image shown the below is intracranial tumor. Image of oral cavity with restricted opening of mouth is shown below. The patient who is chronic tobacco chewer. The diagnosis here is oral submucous fibrosis. Image shown below the characteristic of esophageal carcinoma, or we can say red tail appearance. Identify the pathology depicted in the image. That is osteochondroma. This is osteochondroma. A 35-year male present with lesion of proximal tibia showing eggshell crackling. Lesion in an eccentric and X-ray shows osteolytic lesion just below the joint line. Following is the X-ray patient. What is the most probable diagnosis here is giant cell tumor. X-ray showing here osteoclastoma. X-ray showing here simple bone cyst. Left hand X-ray lytic lesion 16-year-old boy here. Enchondroma. A 20-year-old male present with the lesions shown below. Which of the following tests will help to arrive at diagnosis? So let's see. What is this? This is by potassium hydroxide mount for pityriasis vesicolor. Okay. I also spaghetti meatball appearance. Now, what is this? 25-year-old girl present with papules, erythema and telangiectasia over the face as shown below. She also gives a history of flushing, burning sensation, exposure to sun, emotional disturbances. The diagnosis is rosacea. Yeah. 27-year-old female present with nodule in a right lobe of thyroid. Resection revealed a small nodule of 2 into 2 centimeter. The histopathological slide is shown in the figure. What is the diagnosis? Diagnosis papillary carcinoma. Okay. A 50-year-old male with history of left ureteric calculi present with pain on USG followed by resection of the left kidney. The macroscopic and microscopic pictures are given. What is the most likely diagnosis here? Hydronephrosis with chronic pyelonephritis. In the below given figure, which of the following nerve doesn't pass through the foramen marked as X-ray? This is the foramen. Not passed, that is maxillary nerve, not passed. Structure marked with red arrow in the fetal circulation. The below is. This is foramen oval. Identify the artery marked here. This is basilar artery. This one basilar. Arrow mark in the figure indicates the sinus of brain. Below given CT scan, the brain structure marked is, this is cerebellum. This is cerebellum, this marked structure, cerebellum. Area 4 marked in the picture, the pointing towards the structure of this is the area 4, and this is marked the feature of the lesser wing of sphenoid. Marked structure in the image below indicates, this image below indicates putamen. X-ray neck lateral view, the mark for by the following arrow, this is hyoid. Hyoid. CT scan of abdomen T8 T10 level, identify the marked structure. This one is marked. Seventh is abdominal aorta. So guys, have a good day. Goodbye. That's all for today. If you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it. I hope you like this video, and if you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it, and do not forget to revise this image based MCQs before your exam. Thank you, good day, and goodbye.